Hey everyone! I felt really compelled to come on here and record a video because I've been thinking about this for quite a while, and it kind of comes in waves. It comes up again, it goes away, but overall I feel like it's kind of always been at the back of my mind. Sometimes I probably end up pushing it to the back of my mind, but the overall thought and feeling has never actually gone away. It's always been there for some time, and that's regarding the medical system, specifically nursing, healthcare, and working in the hospital setting as a nurse at the bedside. And this has been a long problem for me, where I felt like I have always been taken advantage of as a nurse working in the bedside, in the hospital setting, because there's just so many tasks, so many things asked of the nurse to be done in an 8-hour or 12-hour shifts, that it is absolutely impossible to get everything done and also properly assess your patients. That's one of the biggest things, is that there's a lot of documentation and there's a lot of I guess I could say nursing assistant work, although nursing assistant work is also the nurse's job. But when you're getting pulled to do tasks that can be delegated all the time to the CNA, because the CNA is stuck in another room, and they can't go and see that patient, and you're trying to document, you're trying to give medications, and you're trying to notify the doctor of imaging or labs, and they're not picking up the phone or whatever the case is, and you're getting pulled to do all of these other tasks that could be delegated if the one CNA or whatever, because they're going to be short because the facility isn't providing enough adequate ancillary support for the nurse, then it's going to fall back onto the nurse, because we're the only ones that have to be there for the entirety of your shift. So there's nobody else there that's going to assume primary care of the patient, that is required as a licensed professional in the hospital setting or any type of facility setting for your shift. It has to be the nurse. It's always going to fall back on the nurse. It's not going to be the doctor. It's not going to be the tech or the CNA or the physical therapist or anybody else who's rounding on the patient, or assuming care of the patient. Primary care goes to the nurse, always licensed nurse. And that is a major issue, especially when it comes to staffing, obviously. Excuse me, getting a little worked up. But this has been weighing on me because it's 100% not realistic. It's impossible. There is no way to properly get all of your tasks done, especially when you're just becoming completely task oriented and you're not even using critical thinking skills. You're not able to do a thorough physical assessment on your patient to look for discrepancies in time frames over the course of their stay in the hospital. Or if you work more in a extended stay setting, acute rehabs, they're there for quite a while, and you need to be able to do assessments and reevaluate their symptoms, why they're there, and see if there's any differences in when they first got there to now, and if that needs to be reported to the doctor or the primary provider. So there's just too many things that have to get done, and I feel that there is an overwhelming sense of dissatisfaction among healthcare providers and nurses in the hospital setting now, because we are just asked to do way too many things, because we're under a business model and not a medical or care model or nursing model. And that has been the way for years on years, way before I became a nurse. And this is not going to change. It's going to be like this unless there is some type of legislation passed on staffing and even changes to overtime pay, minimum breaks. Like California has set minimum breaks for all their staff working in the hospital setting, nurses, and that's just not the case elsewhere. And it's really unfortunate because this is the only setting or profession where nurses are asked to do so much and they don't get anything back in return. For example, what was it? Almost 2 weeks ago, I worked a 8.5 hour shift, and it was on day shift on a Sunday. Nothing had gotten done on Saturday that I thought was going to get done. I had worked Friday evening through to 11, and there were certain things that the patients that I was assigned to Friday nights that I thought were going to get done Saturday that never got done. Like, I don't want to get into detail exactly, but there were certain imaging, there were certain nursing oriented tasks that needed to get done for the patient, and that was not done. I came in to all of these incompleted tasks that I felt compelled to complete because it was the last day of the weekend and I wasn't going to let it go on for another shift or another day. It just didn't seem right to me. And I had set amount of patients in a you could call it a medical surgical setting if you'd like, and it was 6 patients, I believe, 6 patients, yeah. One was just admitted Friday, and that was the one that needed imaging based on their diagnosis coming in on admission, which was not done. And I had no break, no food. I had 2 sips of water, and I didn't go to the bathroom once because I barely drink anything at all. So for 9 hours, I ate nothing, drank nothing. I had to stay an hour and 22 minutes late to finish all my documentation because I had no time to document during my shift, because how would I have had any time since I had to correct all these issues, and then a new issue came up that was never addressed before that I didn't even know about because I didn't have the patient before. So it's just very bizarre to me that and on top of that, this facility that I work at doesn't give you the option when you go to clock out of your shift to say, no, I did not take a uninterrupted 30-minute break during my shift. You have to go in and go to the HR area and fill out a physical form saying that you did not take a break. I've never done it before because I'm not gonna go out of my way to fill out a form saying that I didn't take a 30-minute break, because that just is absolutely ridiculous to me. They want to make it as difficult as possible for people to be able to get correct hours. They don't care if you don't take a break. No one's going to ask you, did you take a break, or did you go eat? Or they're not going to watch your patients for you and make sure that you eat something. It's just not going to happen. There's no supervisor in place doing that. There's no management in place. There's no nothing coming from upper management down to middle management from directors saying this has to happen, because they simply just do not care. But other than the fact that I didn't take a break, which is upsetting, but what is more upsetting is that there's just no consequence for why things are as derailed as they are in the medical system, in the hospital setting. It's absolutely insane to me that things have been running like this for this long, pre-COVID, during COVID, and post-COVID. It is criminal the way that these hospitals are being run. If anyone, outside of the medical system came in and was a fly on the wall for a day and saw how things were run, how poorly staffed all the units are on a regular basis, they would be horrified. They would say, I would never want to get sick. I would never send my family members to the hospital. I would never do anything to allow myself to be in a hospital, because they know that they would see right away that is horrendous. They'd be like, no, absolutely not. Get me out of here. I don't want to be here. I want to go home. It's disgusting. So I'm just absolutely appalled, and I am calling for changes. I'm calling for legislation to be passed, bills to be passed for staffing, and there's got to be on-call staff everywhere. It can't be this, oh, sorry, we don't have anyone, we don't have any ancillary staff, or we don't have enough nurses, so you're just gonna have to pick up extra patients. Sorry. Absolutely not. No. Nope. Because the medical facilities are running on their own license, and that's a license to operate a medical facility. And if something happens, they have their own lawyers, they have their own legality in place to make sure that they don't become held liable for any mistakes that their staff makes while working. So it's going to be, if something were to happen, a mistake by somebody, it's going to fall on that specific person. So they have to deal with the legal fees if they don't have liability insurance connected to their license. And it's going to be a headache because the medical facility has contracts in place for lawyers, and they know how to maneuver themselves to blame the staff, because if you assumed care for an unsafe nursing assignment and you didn't say anything, then that's your fault, basically. There's nothing you can do about it. But when the unsafe assignment is a constant thing, then you're just never going to be able to work, right? It's just never going to happen, because even before COVID and post-COVID, assignments were not safe in the first place for staffing, for appropriate ratios. They've tricked you into thinking what is normal staffing, right? When they say, oh, we're fully staffed, no, you're not actually fully staffed. You're still a little bit understaffed. But when they say you're understaffed, you're just severely understaffed, which is, they're just gaslighting you into thinking what is normal versus what is abnormal. But I guarantee you that safe staffing, it doesn't exist anymore. They're just always going to run at a bare minimal level, and that's considered the normal, right? That's staffed. And then if someone calls out, that's understaffed, and they're not going to do anything to bring it back to that minimum that they call is the minimum or staffed. So that's my little rant. I'm gonna end this video because I don't want to keep complaining, and I'm not going to get into any specifics.